A new blood test that can diagnose Alzheimer's disease up to 15 years before symptoms of the disease appear could soon be available in the United States in the next few days. Dr. Mark Siegel is a Fox News contributor from NYU Langone Medical Center, and he joins us now. So let's go through the three H's here, Doc. How does this work? How accurate is it? And how useful is it?
All great questions, John. First of all, this already is taken from what we do in the spinal fluid. We test the spinal fluid for the abnormal proteins of Alzheimer's disease, tau and beta amyloid. What's most exciting about this study that came out of Sweden in Journal of American Medical Association Neurology is it showed the exact same accuracy in the blood that we see in the spinal fluid. Now, you can imagine we can't test the spinal fluid on a regular basis, but we can do a simple blood test. So accuracy, 96 to 97% on the abnormal proteins of Alzheimer's, up to 15 years in advance of symptoms occurring. And I asked a couple of neurologists today, would you have a use for this? The top neurologist, my wife, by the way, said this: I'm constantly testing people for memory loss, and I don't know if they're on the road to Alzheimer's or not. John, 6 million people in the U.S. have Alzheimer's, but 40 million have mild cognitive impairment. They forgot where they put their car keys. She said this is a huge step forward in figuring out whether someone with memory loss might be on the road towards Alzheimer's. Key being might. Even if you have these proteins, doesn't mean you'll necessarily get it.
So this test, which is not going to be covered by insurance initially, is called ALZ Path DX. It'll cost about $500. Is it worth it, do you think?
I think it will be worth it, and I think it will be covered by insurance for the simple reason that this study came out, which is unbelievably powerful, this study. Over 700 people tested, major neurological journal. I would urge the FDA to take a close look at this, because even if we need a major agency like the American Academy of Neurology to come forward and endorse this. But if the FDA fast tracks this, we'll be able to use it in hospitals, John. I'll be able to use it in my office, which is an appendage of the hospital. I think this needs to happen fast because, again, more tools, the better. About 80% of the people who were tested in this don't even need to go on for a confirmatory PET scan. And your next question is going to be, well, what do we do differently? What we do differently is we could put this together with treatments that are coming out.
Actually, what my next question was going to be, because this is a very personal story for me. My mother died from Alzheimer's disease in 2010. God bless her. She lived to be 96 years old. She didn't develop until she was about 93. So because I'm her son, I'm likely at risk for developing Alzheimer's disease. Do I want to know? And why would I want to know?
Well, you are at risk, John, but you would be more at risk if you had something called an ApoE, which is a high-risk genetic test. So what I'm getting at is we need genetic testing to go along with this and keep pace. Now, why would you want to know? Because a drug like lecanemab, which has gotten a lot of controversy and is out and decreases the risk of buildup of these proteins, has big side effects like brain swelling. I'm only going to want to give this drug to people that have these proteins that I think are at very high risk of developing it, again, up to 15 years in advance. In the laboratory, we're looking at anti-inflammatory treatments that may even be better than lecanemab. 5 years from now, we're going to have treatments to offer. I want to know for another reason. Like with your mom, I want the family to be prepared. I want the family to know this might be coming. Now, we want to do this without scaring a patient or making them feel they have some sentence on their shoulder. So I agree with my wife. I would only use it in people with already having cognitive impairment or memory loss. And not you, John. You don't have a speck of that, and you're not going to get
it. Hang around with me a little longer. You'll find out.
Okay. You just watched where tests can be done. Blood tests can be carried out that costs $500 in the US for someone to know 15 years ahead of time if they are prone to Alzheimer's diseases. Okay, now, what is Alzheimer's? This says Alzheimer's disease is the most common cause of dementia. Alzheimer's is the biological process that begins with the appearance of a buildup of proteins, like the doctor said, in the form of amyloid plaques and all that. Early symptoms include forgetting recent events or conversations, forgetting where you dropped your car keys, forgetting something like that you have an appointment or a meeting the next day, forgetting that you met with someone and had a wonderful conversation last night. There is no cure for Alzheimer's disease. In advanced stages, loss of brain function can cause dehydration, poor nutrition, or infection. These complications can result in death. But medicines may improve symptoms or slow the decline in thinking. Visceral fat may indicate Alzheimer's risk decades before the symptoms. What is visceral fat? The fat we accumulate on our stomach, on our tummy, the lower part of our abdomen. That is visceral fat. And from experience, I am sure you know that it is very difficult to lose belly fat. Not impossible, but very difficult. Visceral fat has been linked with insulin resistance, leading to diabetes, strokes of different types, cancers of some kind. And right now, a new study is showing that it is another link to Alzheimer's disease decades before the symptoms come. Do you have visceral fat? A good amount of it? Then it is time for us to remove it. I have videos where I talk about the things that are necessary for you shedding that stubborn belly fat. A new study links visceral fat, a deep layer of abdominal fat, to increased brain amyloid and tau proteins. Oh, as key markers of Alzheimer's disease, decades before dementia symptoms arise. The study highlights how managing visceral fat through lifestyle changes or medication could reduce Alzheimer's risk. Okay, another blog says fat in the belly correlates with brain amyloid, which is another way of saying that when there is lots of fat accumulated in the stomach, it links that individual to the risk of having Alzheimer's and dementia later on in life. This says this body type is linked to an increased risk of developing Alzheimer's. Which body type is that? You can see for yourself. It's the same thing. Big tummy, especially when you're not pregnant. Visceral fat has been linked to not just Alzheimer's, but insulin resistance, strokes, heart diseases, and some forms of cancers. Now let's talk about your lifestyle choices. Visceral fat can be shrunk, shed, reduced through lifestyle changes. Do you want to make the right lifestyle changes that will reduce this menace? If you do, I have videos that would help you do that. And if you need a handheld assistance and approach to this, please let me know in the comments of this video that you need help. Just write help and I'll reach out to you for us to take this discussion further. It's time for us to make some lifestyle changes that would enable us avoid losing our brain function, our brain memories through Alzheimer's. And for anyone that has already lost their brain functions, there's help. We can trust God for healing while you take your medications, but bear in mind that medications have their side effects. And if you have a family history of dementia or Alzheimer's, one thing you can do is, if you can afford it, you go run the tests that shows you a long way before that time that you may be at risk. Another thing, you can make lifestyle changes. Hi, my name is Ngo, and I am passionate about helping you look your very best no matter your age. Like this video, subscribe if you've not subscribed to my channel, and see you in the next video. Thank you very much for watching. All the best.